Hypertension is a very common condition all over the world, and in India, more than 25% people suffer from it. Most of the time, people are unaware of hypertension because in many cases, there are no symptoms. Those patients who doesn't have symptoms, silently they suffer from hypertension, and hypertension targets some important organs in the body like heart, kidney, and brain. So, unless hypertension is detected by community examination of the blood pressure, many of these patients, a large number of patients, they land up with complications. So, essentially, hypertension is to be detected and treated to the optimal level so that people can lead a normal life and do not suffer from complications. Besides heart, kidney, you can also brain, and you can also have affection of the eyes also, which is called hypertensive retinopathy. So, combining all this, and if the person has got associated diabetes, it becomes more vicious. So, the plan, the program should be such: our doctors, society, and the patients as a whole, they should check their BP and get it below 140 systolic and 90 diastolic. In case of diabetics and some other conditions, this could be below 120 and below 80. So if this pressure can be maintained, then the chances of complications are very less. Now, how to control? Control is to do some, you can say some measures like walking, taking less salt, removing stress, doing yoga, reduction of weight. This can reduce blood pressure to some extent. Rest will depend on medications. There are now, the basket is very wide and full. So according to the patient's choice and need, doctors can prescribe different medications. So these medications might be beta blocker, might be ARB, might be your vasodilators, might be centrally acting medicines. So all these medicines work very nicely and they can control. Many patients resent of taking many tablets. So and they think that if you go on taking tablets, there will be complications in our kidney. But it should be emphasized by our doctors to the patients that if you take tablet, there will be no complications. But if you do not take, then you are going to face the consequences of target organs in target, that is heart, brain, kidney. So, as the need, the patient will take one drug, two drugs, or combination of three drugs. Sometimes we may have to add another drug. So this is in essence. But another type of patients who are actually suffering from secondary hypertension, for example, young persons, when you get a hypertension, they might be suffering from primary disease in the kidney, the blood supply of the kidney, in the adrenal gland. So in those patients, as it is secondary, you have to correct the primary one. So if you can correct the primary one, for example, there is a tumor called pure monocyte. If it is removed, blood pressure will go on. So most of the patients, remember, that are essential hypertension which you get. That means exact causes. It may be familial, it may run in families, it may not run in. But the main message is that hypertension is detected, it has to be treated and bring to the desired levels, and keep on checking the patient, because there will be certain side effects of the antihypertensive. So that has to be checked. Regular checkup of the heart, kidneys have to be done. And if the patient obeys, if the patient sticks to the thing given by the doctors and also start the medication, I think most of the patients will have a normal life. Thank you.